Hello everybody. Welcome to the next lecture on AAT Learning Hub. After my last lecture on cardiac output, today we're going to discuss another important hemodynamic parameter, the blood pressure. One of the most significant determinants of cardiovascular function is the blood pressure. It is defined as the force or pressure of the blood against the vessel walls of the cardiovascular system. Blood pressure is transient and fluctuates during the cardiac cycle. The pressure of the blood flow in the body is produced by the hydrostatic pressure of the blood against the walls of the blood vessels. Fluid always moves from areas of high to low hydrostatic pressure. Why is blood pressure measured in millimeters of mercury? The first instruments used to measure blood pressure relied on a mercury column and hence the unit. As mercury is so much denser than water or blood and has low vapor pressure, even very elevated blood pressures only cause the mercury to rise a few inches. How do you calculate blood pressure? It is a product of cardiac output and systemic vascular resistance. Cardiac output is calculated as heart rate times the stroke volume. I hope you remember this equation from my last lecture on cardiac output. Please feel free to have a revision of it for better understanding. So BP can be calculated by multiplying heart rate, stroke volume, and systemic vascular resistance. Let us use a walking analogy to understand these parameters. The number of steps per minute multiplied by the distance between each step multiplied by perhaps the resistance to walking against the blowing wind. We dealt in detail with the various factors affecting the heart rate and stroke volume in my last lecture. So what is this resistance to walking against the blowing wind, aka systemic vascular resistance? SVR, also known as total peripheral resistance, is the amount of force exerted on circulating blood by the vasculature of the body. Vascular resistance refers to the effects of vascular tone and blood viscosity on flow through a blood vessel. Three factors determine this force: the length of the blood vessel, the diameter of the vessel, and the viscosity of the blood that flows through it. Total peripheral resistance, or SVR, is an important concept to understand because it plays a vital role on the establishment and manipulation of blood pressure. Resistance to blood flow through a vessel increases as the blood becomes more viscous and the vessel becomes more constricted. Let's dig deep into what is mean arterial pressure. Mean arterial pressure is an indication of global perfusion pressure necessary for organ perfusion and oxygen delivery. Mean arterial pressure can be calculated by the addition of 1/3 of systolic blood pressure and 2/3 of diastolic blood pressure. A simple way to remember this is S for single, also representing systolic, D for double, also representing diastolic. So single times systolic blood pressure plus double times diastolic blood pressure, the whole divided by 3 gives your MAP. Normal MAP is around 70 to 100 millimeters of mercury, and a MAP of at least 60 millimeters of mercury is necessary for adequate cerebral perfusion. Note that MAP is largely based on diastolic blood pressure because most of the cardiac cycle is spent in diastole. One cardiac cycle lasts about 0.8 seconds. Under resting conditions, systole occupies 1/3 and diastole 2/3 of the cardiac cycle duration. To brush up further details about the cardiac cycle, please feel free to visit my earlier lecture on all aspects of the cardiac cycle. Let's move on to discuss about pulse pressure. Pulse pressure is the difference between systolic and diastolic BP and is a measure of the force the heart generates when it contracts. A normal pulse pressure is between 40 and 60 millimeters of mercury. Generally, a pulse pressure should be at least 25% of the systolic pressure. Alternatively, mean arterial pressure can also be measured as diastolic BP plus 1/3 of pulse pressure. A pulse pressure below 40 is described as low or narrow. This may occur, for example, in patients with a low stroke volume, which may be seen in congestive heart failure, stenosis of the aortic valve, or significant blood loss following trauma. In contrast, high or wide pulse pressure is common in healthy people following strenuous exercise when their resting pulse pressure of 30 to 40 millimeters of mercury may increase temporarily to 100 millimeters of mercury as stroke volume increases. A persistently high pulse pressure may indicate excessive resistance in the arteries and can degrade the heart, brain, and kidneys and warrant medical treatment. Moving on to what happens in the body if the blood pressure gets altered. It causes a variety of complications due to either high blood pressure or low blood pressure. High blood pressure can damage artery walls, which can lead to plaque buildup, a process called atherosclerosis. Plaque buildup can narrow the inside of the arteries, blocking blood flow to the heart and potentially causing myocardial infarction, commonly called as heart attack. It can cause aggravation and acceleration of atherosclerosis in the cerebral vessels, leading to stroke. High BP is the second leading cause of kidney failure in the United States after diabetes. Hypertension also appears to increase the susceptibility of small and large arteries to atherosclerosis and may end up causing peripheral arterial disease too. This is the American Heart Association classification of blood pressure, categorized into normal, elevated BP, stage 1 hypertension, stage 2 hypertension, and hypertensive crisis. What about low blood pressure? It causes global hypoperfusion to all parts of the body and can potentially lead to ischemia of any or all of the organs. So, to summarize, these are the equations that we have learned so far. Let us try applying them clinically. You measure a patient's blood pressure to be 130 by 85. Now go ahead and calculate the pulse pressure and map and determine whether they fall within normal limits. Please feel free to pause and do your math now. So for the answers, the pulse pressure is 130 minus 85 is 45. Mean arterial pressure is calculated by plugging these values into the formula that we saw earlier and comes to about 100. So both 45 and 100 of pulse pressure and mean arterial pressure respectively are by and large within normal limits. Hope you enjoyed this lecture and found it useful. If you did, please feel free to share with anyone who you think may benefit. Stay tuned for the second part of this blood pressure lecture to uncover more interesting details. Until then, stay focused and stay curious. Bye-bye.